I'm going to introduce our speaker. This is Dr. Lynn Deitrick. She is a member of the Florida Caribbean AIDS Education Training Center, and she has a lengthy history of experience, including over 30 years as a nurse. She's recently published on the nurse.com module, a CEU module on purposeful hourly rounding, and that can be available by going to nurse.com. It's going to be available for consultation following the 31st of August. Her webcast for cultural awareness, which was done a year ago, is available on the homepage of the Perinatal HIV website, and so if you will visit that website, you can click on the arrow and see the first part of this talk that she's going to do for us today. And so I'm going to turn this over to Dr. Deitrick, and she will begin right into her webcast for us. Dr. Deitrick.
Thank you very much, Millie. It's always a pleasure to speak to nurses, being one myself and being a perinatal nurse myself. I know how important it is to really understand the patients that we're working with. So here are your session objectives. I'm not going to read them to you, but afterwards, not only will you be able to understand and explain varying types of medical and alternative medicine practices, but I'm also going to give you a acronym, Be Safe, that will help you in learning how to talk to patients, and we'll also be talking about crucial questions, so you'll have some tools that you'll be able to use as you work with patients from diverse backgrounds. So let's begin by framing what we're talking about as a journey. A lot of people who train on cultural awareness will make it seem as though it's once and done, but it really isn't. It's a lifetime journey. Even though I've been training on cultural awareness for a long time, I'm always learning things. So frame it as a journey of not only learning about other people, but learning about ourselves and growing as we learn more about people and cultures. So as a reminder, why are we talking about cultural awareness? And this slide shows that over 35 million children and adults live with HIV worldwide, and you can see that no place is spared. HIV is everywhere, and this really underscores the need for HIV professionals and health professionals in general to be trained in cultural awareness. So those of you who listened to my first presentation know that this is the definition I like for culture. It's 4 simple concepts: customs, traditions, language, and beliefs. And it's easy to remember because culture is the thing that binds a group of people together. Geography can also play a role. People from the same area or same country may share some or all of these components, but not always. And there's also organizational cultures, professional cultures, etc., each with its own customs, languages, beliefs, and traditions. And think about the organization you work for. When you went through orientation, you probably were taught the culture of the organization, including the customs, language. In nursing, we have certain medical speak that we use, abbreviations we all learned in nursing school, and other things about the organization. So remember that culture is not only about geographic locations, but it's also about organizations and even professional disciplines like nursing. Okay, as a refresher, worldview is important because this is how you view your world. This refers to the culture you were brought up with and the language you learned to speak, and it impacts your view of the world. And your worldview really doesn't change. It's the basics of what we believe, and it also impacts how we see the world and make judgments about the world. And it's not based on skin color, but on culture. And when we talk about worldview, it's important to talk about lived experience. You need to really experience something to understand. So as an example, let's use disability. Unless you've ridden in a wheelchair, you don't know what people who use a wheelchair are living or experiencing. And unless you have HIV, you really can't know what patients living with HIV are going through. Language you speak at home impacts your view of the world. For example, if you speak a language that has words classified as masculine and feminine, they can impact your views on gender and conceptions about gender. If you were to speak a language like Navajo, you might tend to view your world in terms of dimensions. In English, we don't have words for gender. We don't have masculine and feminine words, whereas in some of the Romance languages like French, Spanish, Latin, Italian, objects and words are masculine and feminine, so that may impact how someone views the world and other things. So let's also think about things like color. If you live in the Arctic, you might have 6 or 8 different words for snow: crunchy snow, wet snow, dry snow, whatever. If you live in the tropics, your language may not include a word for snow, but you might have a lot of different words for green, light green, dark green, etc. So it's really important to understand that language can impact who we are and how we see the world. Similarly, language can also be a barrier. If we can't speak the language of those around us, you can understand how that can be a problem. Similarly, professional languages can be a barrier. So for those of us who are clinicians, if we use medical words and medical jargon, people around us and the patients we're working with, they may be completely in the dark about what those words mean. So we have to understand that language can create barriers for people seeking health care, and we have to be very aware of that as we go forward. Cultural relativism is a key concept in our journey towards cultural awareness, and that's the belief that other cultures and ways of doing things are different but equally valid. And this is the opposite of ethnocentric. Ethnocentric means that you think your culture is better than everyone else. Cultural relativism is saying there are many ways of doing things and they may be different, but they're valid. So try to keep a cultural relativistic point of view as you learn about other people and other cultures. So how do we become more culturally aware? Well, I like this definition or this model. And notice there's arrows, so it's a continuous process. It includes respect, communication, understanding, and engagement. You're going to see a lot of different models out there, and you're also going to hear this called different things: cultural awareness, cultural competence, all those terms. I like the term cultural awareness because cultural awareness to me presents the idea of looking across the table in an equal manner. When you say cultural competence, it tends to promote ideas of us versus them, and we don't want to think of our patients as them. We want to think of everyone as being equal across the table. So I use the term cultural awareness because it's a mutual growth process. So these 4 stages work well, and I think they'll be helpful to you as we move forward. So culture can influence many aspects of people's lives, and some of these include understandings and priorities about health and illness, the way people interact with a healthcare system, decisions about seeking medical help, and participation in prevention and programs. And you may say, but doesn't everybody want to get healthy and think about prevention? Well, if you're from a belief that your illness or your condition is caused by God and is punishment, then you may think, well, if God's punishing me, then why do I want to have prevention? Because it's not up to me to prevent the illness. It's up to God whether or not I get sick. So understanding that culture can impact the way people not only understand health and illness, but decisions about seeking medical help. This also includes access to care. If you have a family with a lot of children and one of the children is sick, it may be that to get to the clinic, they have to take a bus. And if you've got several children, you may have to take all of them with you when you go to the clinic, And if you have limited resources, bus fare to go to the clinic may be an item when you have to not only take yourself and the sick child, but their siblings as well because you don't have anyone to watch them. So this applies whether we're talking about HIV, whether we're talking about pregnancy, whether we're talking about anything. Also, decisions about seeking help, sometimes it's not the mother, but it's the father who makes the decision, and he may prioritize based on the perceived value of that person to the family. In some cultures, females are considered lesser members of the family, and they may get what's left of the food and the money and the health and education resources, and priority might be given to male children or to family members who are working. So again, the way people make decisions about health care and all of that can be influenced by culture. Before we talk about health and illness, let's talk about cultural constructs. And this is an important term to understand because many cultures have their own ideas about life, health, and spiritual matters that have been handed down through generations. These constructs sometimes can differ from the scientific, so it's crucial to learn what people understand about health and illness in order to effectively help them achieve improvements in their health. As you will learn, not everyone believes in Western biological explanations of disease causality. And many cultures define health and illness in different ways, such as the body forces being in or out of balance, the spirit moving you and causing a problem, such as a convulsion. Mental illness may be due to a heightened ability to talk to the spirits, and so forth. Some of us may have heard our grandmothers or mothers tell us not to go out with wet hair or we would get sick, or don't walk across a cold floor with bare feet or you'll catch a cold. And these are all examples of cultural constructs about illness and what causes illness. Here in the U.S., we use a scientific model for explaining phenomena around us. Different cultures may not. So the next thing I want to talk about is an explanatory model, and let's use rain. So in the scientific model, we know that rain is caused by atmospheric conditions. If you believe that health and illness are determined by spirits or your faith, then you may say, well, God makes it rain, so if I want it to rain, I have to pray for rain. And you'll know certain cultures have certain things they do to ask the spirits for rain. And then if you were a Navajo believed that the spirits of their ancestors who died live in the clouds, and that when it rains, it's those ancestors that are allowing it to rain. So it's important to understand that if a person was raised with one belief system about the cause of illness and health, then it's going to be difficult to change their worldview. So it's important not to assume that everybody ascribes to the Western belief of illness causation. And most cultures have an explanatory model for illness. So let's look at epilepsy, for example. In the scientific or biomedical model, epilepsy is caused by a problem with electrical functioning in the brain. In a religious point of view, epilepsy is caused by God challenging you or spirit possession. And in a culture such as Hmong, who are mountain farmers from Laos and Southeast Asia, they believe that epilepsy or a seizure is caused by the spirit catching you and you fall down. And this is important to understand because there was a disconnect about the understanding of illness causality that occurred back in the 1980s. That's really the reason why we educate providers on cultural awareness, and that is a case of a Hmong family who were resettled in the U.S. from Laos. They lived in Merced, California, and they had 19 children. One of their children, Leah, had seizures, so they took her to the local Hmong healer who told them that her seizures were due to the spirit catching you and you fall down. The healer gave them traditional remedies to use for Leah and also consulted the spirits. Leah kept having seizures, and eventually she was taken to the hospital where doctors diagnosed her with epilepsy. The doctors gave Leah's parents prescriptions for seizure medication to control her epilepsy. However, they didn't fill the prescription, preferring instead to have Leah treated by the local Hmong healer. Eventually, Child Protective Services got involved, but the end result was that Leah died from epilepsy. And she died not because her parents were bad parents or neglectful, but because they believed in the spirit possession as a cause of epilepsy. The doctors were insistent that it was the electrical functioning in the brain. They handed her parents a paper prescription. They didn't know what the paper said, what it was for, or what the pills would do. They didn't get it filled. And the tragedy is the child ended up dying. Obviously, the doctors and the parents both wanted what was best for the child, but there was a cultural disconnect. So this story was written in a book called The Spirit Catches You and You Fall Down, which is it was by Anna Fadman, and I would suggest you read that book because it was this case that was well publicized that really is the reason why we train people in cultural awareness today. This tragedy didn't have to happen, but the parents didn't understand Western medicine and the doctors didn't understand the Hmong concept of disease causality, and it ended in tragedy. And I spent a little time on that because that's a really important understanding. A lot of people, even if they seek Western medicine, may also be using their own, may have their own beliefs about the cause of their illness, so you really have to be able to tease out what their beliefs are. So I want to turn now to what we call CAM, or Complementary and Alternative Medicine. This includes folk medicine, and it's important to understand that many people, including those with chronic conditions such as HIV, use complementary and alternative medicine, including traditional healing approaches. And patients often seek out these treatments alongside their conventional medical treatment. And so it's important to understand what these are. And an important thing to understand is that people choose to use CAM practices because they believe in them. So what exactly is CAM? Well, CAM is, as I said, it is complementary alternative medicine, and what it does is it seeks to use other non-Western medicine concepts for disease, healing disease. And the important thing about CAM is it treats the whole person, mind, body, and spirit, and as many as 60% of people living with HIV may use complementary and alternative medicine along with ART drugs. So it's important to know that these things are out there. So some of the things of folk medicine include things like medicinal plants and herbs, spiritual cures, teas, potions, lotions, aromatics, poultices, and food. Along with the idea of complementary and alternative medicine are traditional healers, and many cultures have traditional healers whom people may consult when they are ill. And understand that when people migrate to this country, often the traditional healers come too. So in areas where we have a lot of people from certain cultures, chances are good that you're going to have traditional healers there. You're going to have sources for traditional medicine, herbal teas, things like that. So healers know how to provide information to people in a linguistic and culturally fluent manner. It's important to know that these are often very respected members of the community, and they have a great deal of knowledge and training about traditional methods of healing, and they can be called many things. I want to now briefly turn our attention to the belief system that we call humoral medicine. And this is important to talk about only briefly, but there's a lot of traditional medical systems that believe in the concept of body balance. So if you look at this diagram, you'll see hot and cold are opposite of each other, as are wet and dry. And you'll see these belief systems in many places, including Greece, India, Asia, and Latin America. And a lot of cultures believe that health is when the body fluids and body systems are in balance. So illness and food is often classified based on whether it's hot or cold, and things are the opposite. So, and it often doesn't make sense to us how things are classified. So you really need to ask the patient how they conceive of the disease. So for example, it's important to understand if a person has a respiratory illness, do they think of it as hot or cold? And if they do, what's the opposite treatment? So think about the old adage of chicken soup for a cold. Well, this is an example of the hot-cold framework, because a cold or respiratory illness in many cultures that use humoral medicine, a respiratory illness may be classified as cold, so the opposite of cold is hot. Therefore, hot chicken soup would be believed that if you use that, it will help bring the body back into a balance between hot and cold. So again, it's important if people are from cultures that ascribe to the hot and cold framework, it's important to understand how they classify their own illness. And we'll discuss this a little bit as we go forward. So next we'll discuss key aspects of Latino traditional medicine. In this system, health consists of both physical and spiritual elements, and three concepts of fatalismo, respeto, and personalismo are important components of this traditional medicine system. Fatalismo is illness is considered a punishment from God. Respeto is respect and deference. People want to be treated with respect. And personalismo, where people expect a personal one-on-one relationship with their provider. And before I go any further, I want to make clear that it's important not to stereotype people. Just because someone is from a specific culture doesn't necessarily believe that they ascribe to some of the traditional medical concepts. I more want you to understand what is out there, and then it's up to you to discuss with your patient what their ideas are about their health, their illness, what it's caused, and what they see as a course of treatment, and then come to an agreement about how to move forward. So patients in many cultures sometimes exclude conventional medical care and prefer to use someone from their own culture that they trust for their cure. Curanderos in Latin America serve as an important resource for treatment when Western health services are unwanted or unavailable. So here you see a picture of a curandero with her blankets spread out, where you can see different things that they have for sale. And with the curandero, they provide treatment for a whole host of conditions in a culturally acceptable way, and the emphasis is on holistic treatment and the link between spiritual, emotional, and social factors that are important to Latino patients. And it's also important to understand that people may be seeing a traditional healer at the same time that they're seeing a Western physician. So it's important to understand who they're seeing, and to talk to your patients about what care they're receiving, who they're seeing, and what they may be receiving in terms of herbal remedies. Because curanderos may offer herbal remedies that may have negative interactions with conventional HIV medications. But in a lot of cultures, curanderos have historically worked cooperatively and effectively with conventional clinicians, increasing the clinician's reach and effectively communicating health information. So if you have a community where a lot of patients are coming to your clinic and they seem to be utilizing complementary or traditional medicine, it might be helpful to find out who their traditional healer is, build linkages with that person so that you can work together to provide optimum care for your patients. Within the Latin American community, you're often going to see stores called botanicas, and these often sell traditional herbal medicine and items associated with spiritual healing, such as saint candles, ceremonial items, and religious talismans. And these are often focal points of the Latino community since they often provide health treatment and information. And if you're able to read Spanish, you can see on the sign outside this botanica some of the things that they provide treatment for. And it's not just the Latino community, but a lot of communities have similar stores. The Asian community has herbal medicine stores and use a lot of herbs as well. So it's important to understand that in a lot of communities, these types of traditional medicine stores also serve as a source of support and health information, and sometimes a traditional healer works out of one of these stores. And the reason people often go to these stores is because the service provided resonates with the cultural understandings of health and illness. So again, it's important to familiarize yourself with these stores and what may be provided there. Now I'm going to do a brief run-through of the cultural beliefs of various cultures that we may encounter in our daily practice. So this slide in a nutshell talks about Muslim patients, key tenets of Islam, and HIV. Now you're going to see probably very low rates of HIV due to the beliefs about sex outside of marriage, and but it's important to understand that Muslim patients tend to have a fatalistic view of health, meaning that health is not something they can control, and individual's health is in Allah's hands. And so they may see health-related behavior as being of little consequence since Allah is in control. It's also important to understand the importance of gender roles and chaperones in this culture. Women often do not travel alone, often are accompanied to medical visits by a male relative or their husband, and it's not uncommon for a male relative or husband to want to be present during exams and consultations. Female patients may avoid direct eye contact with providers of the opposite sex, and Muslim patients tend to be more comfortable being cared for by providers of the same gender, and modesty is important in females. Also, the next culture we're going to talk a little bit about, we're going to talk about voodoo, and notice the spelling. This is the correct spelling of voodoo. We have a large Haitian population here in Florida, so it's important to understand that voodoo is an important cultural tradition in many parts of Haiti. It's a religion and lifestyle with roots in 18th century Africa and is practiced in many parts of Haiti, the U.S., the Caribbean, and Africa. And it's often misunderstood as evil and associated with zombies, in large part to movies and TV. But the magic of voodoo is believed to bring good fortune and healing. And there are many Haitian natural and traditional healers that don't practice voodoo. However, it's important to note that as many as 80 to 90% of Haitian and Haitian American households utilize alternative medicine of some sort, including voodoo. Okay, so again, know that voodoo is out there. Note that soul loss is the belief of what causes illness, and magic and sorcery are often used to bring people back to health. And in French, AIDS is referred to as SIDA, S-I-D-A, and HIV in French is known as spelled V-I-H. So it's important to understand those terms. Santeria is another spiritual practice with origins in Africa that is seen in cultures in the Caribbean, Cuba, Latin America, and parts of Africa. We also see Santeria practiced in some areas here in the U.S., and it's similar to voodoo, And the name derives from the word santo, meaning saint, and it's a blend of Catholicism and African religious traditions. And it's a religion that in part was developed by escaped slaves who integrated into communities in the Caribbean, brought some of their African practices and blended them with the Catholicism that was being practiced in those areas. So it's a fascinating religion. The belief is that the spiritual world has forces and entities that lend support to healing. A concept of internal balance of body forces and spirits is important. And Santeria uses songs and trance to address physical issues. It's important to understand the concept of trance because trances are often brought about by the use of herbs, and some of those herbs, including tobacco, may interact with HIV and other drugs that patients may be taking. So it's important to understand that if your patient is practicing Santeria, they may be using herbs and substances to get into trance to help them in their healing. Okay, our next topic we're going to talk about is traditional Chinese medicine. And in Chinese medicine, there's a belief, again, in body balance, the concept of yin and yang to maintain health. And illness is seen as an internal imbalance, and the goal is to correct the imbalances to allow the body to heal itself and restore balance and health. And traditional Chinese medicine has been practiced by people in many parts of Asia for more than 5,000 years. And many Asian HIV patients will use traditional Chinese medicine, including medicinal herbs and teas, as a general health practice, regardless of HIV status or treatment. You're likely to find herbal stores in Asian communities, and harmony and avoidance of conflict are hallmarks of Asian culture. So it's important to understand that because teas and herbal medicine are very important in traditional Chinese medicine, many Asian patients will be taking various teas. So again, it's important to talk to them about what they're taking so that you'll know whether or not those may have an impact on any medications you may be giving your patient. I'm not going to really talk about Zen, but just know that it's a form of Buddhism, and it has to do with movement, and again, it deals with the concept of balance and harmony, but I wanted to just make you aware that it's a practice that people may use. Acupuncture, again, I'm not going to dwell on, but this has been practiced in Asia for over 3,000 years. And it's the art of inserting fine sterile metal needles into specific points of the body in order to control the flow of energy through the body and restore balance. So again, acupuncture is often sought out by many people for treatment of many things, and acupuncture often have their own practices, and they're licensed and very well educated. So be aware again, if you have patients that are Asian, they may be seeking out acupuncture. And we even find now that a lot of people are seeking acupuncture that aren't even Asian. It's just thought of as a traditional form of healing that has healing properties, so a lot of people will use it. Naturopathic medicine, I'm not going to dwell on this one either, but it's the belief that the body has an innate healing ability, and it's the emphasis on prevention. There's a lot of use of botanicals, and naturopathic physicians are specialized in use of botanical medicine, vitamins, mineral and dietary supplements, and similar things. So again, naturopathic healers are out there, and people are using these treatments. And naturopathic medicine is becoming much more common in the care of patients with HIV, cancer, and related things. Spirituality and faith are important resources for dealing with illness as well as with the uncertainties of chronic illness. And spirituality promotes the health of the human spirit and can be either by an organized formal faith tradition or other types of spirituality. And some people may believe that illness is caused by God or a higher being, and so therefore they're going to want to pray to that being or to God for curing. And sometimes people will say that their illness is caused by God as a punishment. So then they believe that they have to make some sort of atonement in order to be healed. So now we're going to switch gears and talk about how we can create culturally appropriate therapeutic care environments for our patients. Culturally appropriate care means creating an environment in which the best medical practices can be safely accessed and people feel welcome. Learning about culture is one way to achieve this goal, and so we're going to spend some time now talking about how we create this safe, welcoming environment. Part of creating this environment is examining your organization for effective communication. Effective communication is essential in working with people from different cultural backgrounds. And this chart's important because it illustrates how to communicate effectively with people at every point of contact. Speaking the same language is not enough. You need to ensure that the understanding is the same. So what I like to recommend is a secret shopper process where you send someone that is not known to people in your organization, send them to your clinic or your site, let them pose as a patient and experience door to door, and then come back with insights about areas where you can improve the environment to make things more welcoming for patients. So the next question is, how do we become more effective in communicating with our patients? Be Safe is an acronym to help you remember how to work with culturally diverse patients. Knowing your patients and the important aspects of their cultural beliefs is important. This model was developed by the National Minority AIDS Education and Training Center to help providers learn to be more culturally aware in their work with patients. Each letter stands for a specific behavior that is part of the patient encounter. Barriers to care is the first one, and this means that the provider should be aware of the possible barriers to care for patients in their service area. This can include things like mistrust of the medical system, stigma, bias, fears of just generally going to the doctor. Also can include things like transportation issues, economics, lack of health care, things like that. E is for ethics, and this means demonstrating mutual respect to all patients. This includes telling the truth, honoring the patient's perspective and autonomy, and also confidentiality. S is for sensitivity of the provider. It's important to know your own personal biases and prejudices and try to overcome them by learning about other cultures and traditions. Providers should try to learn about cultural traditions of their patients, and it's also important to show empathy, maintain privacy, and confidentiality. This is also important if you know your patient is from a culture where modesty is valued and chaperones are important. Be sensitive to that. Don't, leave your patient exposed. Cover them and be aware of their need for privacy and being covered. Assessment. It's important to focus on the whole person during assessment and relate findings to your patient based on their cultural background. So by this I mean talk to them about what their cultural traditions are, how do they believe their illness was caused, what do they believe is needed to restore their health, and try to then explain their illness based on their own cultural beliefs. Facts. Know the facts about your patient and HIV and how culture, age, sexual practices, economics, and drug use may impact them. Ask your patient about their cultural practices. And E is for encounters. Provide patients with information that is simple and clear and make sure they understand. Use teach back or an interpreter if necessary. pay attention to body language, tone of voice, and eye contact. And the crucial questions on the next slide are going to help you find out many of these be safe elements. And it's important to understand that a diagnosis of HIV or AIDS carries stigma that may interfere with people seeking HIV care. Arthur Kleinman was a prominent psychiatrist and medical anthropologist at Harvard who's worked to understand cultural perceptions of health and illness. He suggests asking patients these 9 crucial questions or variations of these questions in order to understand their perceptions about the cause of their illness. Now, I'm not saying use all 9. We don't usually have time during clinical encounters for that. But pick 1 or 2 of these questions that you're comfortable with and use that as a conversation starter with your patients. Be aware, too, that even gestures matter. Many cultures tend to view hand gestures as rude or offensive, so avoid gestures such as thumbs up, pointing, hang 10, okay, and other hand gestures. Also, in some cultures, direct eye contact is not made due to issues related to respect, or it may be improper for people of the opposite sex from the provider to make eye contact with them. And chaperones are often expected for patients of opposite gender from the provider. Also, humor may be misunderstood. So again, if you're someone who tends to use humor, be very careful about that. So in review, how do we become more culturally aware? By engaging with others in a purposeful way, using these 4 areas of respect, communication, understanding, and engagement. Ask about differences. Gain comfort and experience talking with people about culture and cultural differences, and you may find that you're learning a lot of interesting things. So in summary then, we've covered all of these topics. We've talked about complementary and alternative medicine. We've talked about be safe, and we've talked about the crucial questions. And Kleinman's questions offer possible conversation starters. Sometimes knowing how to start the conversation is the hardest part of communication. Finally, an important part of the journey towards becoming culturally aware is examining yourself and knowing your own bias. Understand how others see you. Become curious about other cultures. Keep talking and learning. Implement some of the tools discussed today, including be safe and crucial questions. Remember, this is a journey of self-awareness and growth for all of us. And as we conclude, I want to leave you with another look at this map as a reminder about why cultural awareness is important. Our patients are diverse, so it's imperative that we know about the diverse cultural and health practices of the people we care for in our work. So this slide reminds you that the journey continues. Today we've learned about people and culture and how people from different cultures view health and illness. As you continue your journey towards becoming more culturally aware, I hope you will find it rewarding. Remember, this is a journey of self-awareness and growth, so enjoy it. Here's some suggested readings if you're interested in learning more. And the book I recommended, The Spirit Catches You and You Fall Down, is pictured here. That might be a good place to start if you're interested in learning more about culture. And then here's the reading list. If you want to print off as a bibliography, you may do so. And here's my contact information should you want to follow up and have questions.
I'm going to go ahead and bring up a question for you, Dr. Deitrick. In talking about the cultural diversity that we have here in the state of Florida, this is why this subject is so extremely important. What would you say is one of the hardest things in HIV care to get past cultural differences? Can you identify maybe one principle that seems to be the most difficult?
Well, I think the hardest thing is to get people to really come to terms with the fact that they have HIV. Sometimes even admitting to HIV can produce great anxiety. And let me give you an example. For example, in the Middle East, people that have HIV or are or are thought to be gay, they're taken to tall buildings and they're thrown off tall buildings. So if you are from a Middle Eastern culture and you have HIV, you might be afraid to disclose that you have HIV because of what happens in your home country. People would get thrown off of buildings, and you may not know how you're going to be thought of here.
Here too, as well, where they are shunned from their community because their diagnosis is revealed to those within their culture.
Yeah, in some cultures they're also considered to be unclean, and they may be made to go live outside or somewhere else. So I think even coming to terms and admitting that they have HIV is paramount, and it's also important to pull out from your patient, if you can, how they believe they got it, because a lot of people may not think or may not link things like dirty needles or sexual transmission. They may view HIV as punishment from God. Yeah. So it's important to understand how they believe they got it and how they believe it needs to be dealt with. In other words, is there a treatment? Are they open to treatment, or if they view it as a punishment, are they fatalistic in their view of it? Well, God's punishing me and I'm going to suffer. So again, it's important to see what your patients believe, and that's where the Be Safe and the crucial questions I presented can help with some of these difficult conversations.